Well, in 2008, when it was first clear we were going to get some sort of big health reform, my colleagues all said, this is a terrible idea, it doesn't have enough quality, it doesn't have enough population health, it doesn't have enough cost containment. And I said, shut up, criticize it when it's implemented. And I've been saying that for 2009, 2010, 2011, 2012, 2013, 2014. I think we can provisionally declare victory and start complaining about it. The odds are that the Affordable Care Act is here to stay. So the United States passed universal health care, not so surprising. A generation or so after democratization in the 1960s, you tend to get universal health care after democratization. That was the civil rights movement, by the way. And the Affordable Care Act is about as good as Congress would pass. You don't evaluate it by the standards of health systems. That's too depressing. You evaluate it by the standards of the United States legislative process and judicial system, in which making large coherent legislation is a bit like a dog walking on its hind legs. You're impressive that it happened at all. It's probably stable. There is no Republican support for any reform, no matter how small and commonsensical, because nobody wants to be caught dead voting for Obamacare. Democrats aren't even bothering, and they don't have control of the legislature. On the other hand, for a variety of tricky political, technical reasons, it's going to be really hard to repeal, even if President Trump is inaugurated in January. Trump's commitment to repealing it, by the way, is not clear. The system has also been rewired. Businesses do not have the luxury that I do of sitting around saying what might happen. The healthcare industry decided to assume it was being implemented the day it started. So we've rewired the American healthcare system. How have we done that? Well, the Affordable Care Act and the previous stimulus bill created an enormous investment in what Joe White calls the Aspirational Agenda. And that's a farrago of payment reforms, system integration, skill mix, regulatory tweaks, information technology, which is supposed to make healthcare better and more efficient in all sorts of ways. This agenda is universal. Only the United States, however, made the decision that that would be the health policy agenda and that we would forego something more obvious like, say, price controls. So what is a bet? We've made a big bet that the problems of the American healthcare system, of which I'm sure you're aware, are going to be solved by a combination of information technology, management, which enables integration, and insurance companies. Sir Humphrey would call that brave. Okay? Information technology. That works really well in health, we know. You implement it, you roll it out, people like it, people use it appropriately, and services just get better. And we're going to do this in a country with lousy standard setting, a whole host of proprietary data problems. People routinely steal and resell public data as their entire business model. Everybody wants to hang on to the data. The systems are crud. We've got a subsidized category of IT companies that are absolutely useless. This is not where I would conduct an experiment in the wonders of health IT. Oh, and there's 300 million of us and 40,000 provider systems and so forth. Management? Well, it's imperfect. Health insurance companies? Well, they pay consultants to tell us that they're really good at reorganizing care, but they don't have a good record in any country I know of controlling healthcare costs or improving quality. So what do we have then? We have a really big and dramatic bet on the aspirational agenda, but we still haven't, because of our political system, done what pretty much every other country represented in the room has done by way of establishing at least cost control in the system. We're probably not going to have any reform for a good long time, which means that you project forward some combination of increasingly large systems that are good as business organizations and incompetent as healthcare organizations, cost containment by making people's insurance worse, for which they will probably blame Democrats, lots and lots of IT expenditure if you're looking for a job in the United States, with income, not necessarily a sense of efficacy. And finally, the ongoing perpetuation of the great American tradition of looking at a problem, seeing a solution, deciding not to adopt the solution, and then financing studies of the problem. So I think the journal is going to have a happy future.
Well, Thank you. Although today I'll be talking about politics and specifically our upcoming November 2016 election. Hope that I end up complimenting rather than repeating what Scott had talked about. Just first a little bit about what we're hearing on the campaign trail. The Democratic candidates, they all support the Affordable Care Act. We do have a semi-socialist candidate named Bernie Sanders, and he supports it, but he also supports a single-payer system, but that has no legs whatsoever. Actually, his home state of Vermont approved a single-payer system, but even after it was approved, it isn't being implemented just because the tax burden it would have imposed would be too large. So what are the Democrats talking about? Well, the main thing that I'm hearing is about prescription drug prices. We've had a little bit of a perfect storm lately. We've had a couple new drugs for hepatitis C, for cholesterol, that have come in at very high prices. And then I think that even bigger has been some companies, hedge funds buying up other companies. What they've done is they've raised prices on existing drugs, sometimes generic, sometimes 15 or 20-fold. This has gotten the Democrats all riled up, and they're talking a lot about doing something about drug prices. Specifically, we're hearing about prior approval. We're hearing about having in the Medicare program for seniors and disabled negotiate prices, which they're currently not allowed to do. So that's the main point, I think, for the Democrats. All the Republicans, and there are over a dozen of them running for president, say they want to repeal the Affordable Care Act. And in a moment, I'll echo what Scott said, how difficult it will be for them to do that. There's really no detail about how they want to replace it right now. What'll be interesting for us to see is whether there is any detail that comes out by the time of the election. It might be during the actual debates, Democrat versus Republican. The Democratic candidate, probably Hillary Clinton, will force it out of them. But at this point, we don't know whether we'll really get much detail. We really hear four main themes, though. The first one is removing the individual mandate to purchase coverage, which exists under Obamacare, but to replace it probably with a system of some system of subsidies, but most likely these subsidies will not be income-based the way they are now under the Affordable Care Act, but they'll probably be through tax credits. What that's going to do is help the middle class and the wealthy, and it will hurt the poor and the lower and other lower income people, which is the main divide between the parties anyway, I would say. Less clear is how these proposals would deal with the adverse selection that may result when people aren't required to purchase health insurance. So that's something that really does not have a solution. So it'll be interesting to see how that develops in the debate. The second thing we're hearing from the Republicans is moving regulatory power to the states and away from the federal government. They're talking about block grants for Medicaid or a system for the poor. And also one interesting thing is allowing people to shop across state lines for health insurance. The idea they're saying is people can get cheaper coverage, but the Democrats saying this is a race to the bottom, that if you allow people to buy in California to buy policies from companies in Alabama, that they might be really crummy policies even though they're cheaper. But this is something that they're advocating. A third thing they're advocating, we hear this elsewhere, is more emphasis on health savings account and high deductible plans. And finally, moving our Medicare program to something called a premium support program. This is a defined contribution type program. It's really an Enthoven-like style program that we already have in the United States for most employer health care insurance. It's not actually a radical idea, but it's a very controversial idea. So we hear about all these changes, at least from the Republicans, but having said this, it's very unlikely that major changes will happen. Even if the Democrats win the presidency, they're not going to win the House of Representatives. That's going to be in Republican hands for a long, long time. And so the Republican House of Representatives will be able to block any reforms the Democrats want to do. So what if the Republicans win the presidency? Are they going to win the Senate? Well, right now they have a 4-seat majority in the Senate. Of the 34 seats up for grabs, Only 10 of them are Democrats, 24 Republicans, but still it's going to be very hard for the Democrats to overcome that, given how safe some of the seats are. But even if the Republicans have the presidency, they keep the Senate, they have the House of Representatives, it's still going to be very hard to make the changes because they don't have something called a supermajority in the Senate. These are the arcane things that Scott didn't want to get into. But basically, Democrats can filibuster things if they have at least 40 seats, and they will. However, there is a possible exception. This is how Obamacare was passed before, called reconciliation, which allows you to pass things in the Senate if you attach it with a simple majority of 50 votes, if you attach it to a budget bill. So the question is, can the Republicans repeal Obamacare if they have all of the houses of Congress and they attach it to a budget bill? And this is all new territory, so I can't answer that question, and you're the political scientist anyway. But let me say how it's going to be difficult. A lot of people have been helped by the Affordable Care Act. A lot of people have insurance who didn't have it before, and it's not just lower income people. The middle income people and upper income people have been helped too, because children under 26 and their parents have benefited by now being able to get coverage from the parents' employers. And so it's going to be very hard to get rid of Obamacare because a lot of people have benefited from it. So my guess is that even no matter what happens in the election, that major changes are probably going to not take place, no matter what happens.
Thank you, Tom.
Thank you.